Now, in efforts to eliminate violence aimed at women and children, #KeReady Youth Health Movement is stepping up campaign during the 16 Days of Activism. KeReady actively engages in educational campaigns to equip the youth with the knowledge, awareness and understanding of the lifelong negative effects that gender-based violence has on its victims. KeReady was launched in 2022 as a youth COVID-19 vaccination campaign, but it has since evolved into a movement. Let's speak to Dr Busi Kabane, KeReady's provincial lead here in Gauteng. Good evening to you, Doctor. Thank you very much for joining us here on Newsnight.
Evening. Thank you for having me.
My absolute pleasure. So let's talk about the KeReady campaign and how it's evolved since 2022.
I'm sure. So KeReady was started in response to the COVID-19 pandemic, but from that, going into communities, we realized there was a need, to bring healthcare services to communities that can't access it. And so it evolved into a project with 46 mobile clinics that travel throughout South Africa to make healthcare accessible to young South Africans in particular.
So how then does it tie into the 16 Days of Activism campaign that we have seen that we saw roll out earlier this week? What's the connection?
I'm sure. So we know that with GBV, traditionally you think of victims interacting, with authorities through the police services, but often it's identified in the healthcare space as well. And so as a healthcare movement for young people, we take it upon as our own responsibility to, highlight, campaign for GBV, tell our patients, our clients, people who know of our project, how can they access help. We know that it's not easy for GBV victims to come forward. It takes about 7 attempts to get out of an abusive relationship.